Or grandparent, what type of environment is your baby sleeping in? It's an important question. It's estimated that 3,500 infants die every year in the U.S. due to sleep-related deaths. Joining us now to talk about safe sleep is Olivia Burgess. She is the clinical nurse manager in the family birthplace at the Hospital of Central Connecticut in New Britain. Welcome.
Thank you for having me.
I can't see, but is that a real baby?
This is not a real baby.
Okay, I'm sorry. I just had to ask. When we hear the term safe sleep, what does that mean?
So safe sleep basically means that you are putting your baby down to sleep in a safe environment, keeping the baby from harm, such as choking, suffocation, or SIDS, which is sudden infant death syndrome. These recommendations for safe sleep are in place really from the moment a baby is born up to 1 year of age.
I know it's such an important topic. All right, what are the general recommendations when a baby is sleeping?
So I have a great example here. As you can see, this baby is flat on its back on a firm, flat surface. The baby is in a sleep sack, and it doesn't have any items around the bed that could cause suffocation. So the room temperature should always be moderate, not too hot, not too cold. The baby should be completely alone in the crib with no siblings in the bed and no parents sharing the bed space. In addition, the baby should always be either swaddled or in a sleep sack with no loose bedding.
All right, what about placing any items in the crib with the baby, like stuffed animals or those crib bumpers?
So many parents get these awesome stuffed animals and they just want to put them all over the bed like this. Stuffed animals, bumpers, they think that it's really helping keep the baby safe. But what a lot of people don't know is that these items can cause suffocation. So as you can see here, I have a big fluffy blanket. If the baby moves at all in its sleep, this blanket can come up and cover the baby's face and cause suffocation. So you really want to remove every single item out of the crib. The baby will be perfectly warm in its sleep sack. You want to take the stuffed animals out and keep those for playtime.
Great advice and demonstration. All right, the Hospital of Central Connecticut was just recognized nationally for its education efforts on this topic. Congratulations, and tell us about that.
So we're super excited about this recommendation because we really want parents and caregivers to have the most up-to-date information about safe sleep guidelines. The guidelines have changed a lot in the recent years, and you would actually be surprised how many people don't know the most up-to-date guidelines. We want to do everything we can as a hospital and as a system to make sure that babies are going home to a safe environment and that no harm comes to them.
All right, so in the crib, alone, swaddled, nothing else.
Exactly.
Olivia Burgess, clinical nurse manager at the Hospital of Central Connecticut. Great information to new parents and grandparents. It can be such an overwhelming and scary time. Thank you for the information.